Okay. Thanks to the conference organizers for inviting me to come give a talk here. I hope that what I'm going to talk about is kind of connected to the conference themes to the same extent that the talks this morning clearly were. I'm going to talk about choice effectiveness in health insurance markets, and I'm going to kind of talk about this in three stages. One stage is kind of what I call mistakes, and we'll get into what I mean by that. Another one is what I'll call consequences, which means kind of the welfare implications of kind of decision-making issues. And the third thing I'm going to talk about is solutions. And solutions really means kind of, I'm going to talk about kind of a range of solutions to consumer mistakes, ranging from kind of more consumer-driven solutions like information provision and things like that, to more paternalistic solutions, which would be something like, plan regulation that's very strong, or targeted defaults and things like that. Now, on the equity side, I'll be very honest. I'm not sure that in what kind of the stuff I'm going to talk about today, there's that much that kind of directly hits the theme of equity. But I do want to return at the end to a couple things related to equity that I think are kind of really open questions in this literature that I think are kind of very promising avenues for future work, and kind of build directly on the literature I'm going to talk about here. Okay. So I don't think it's very surprising to people in this room that consumers often make mistakes in insurance choices. Okay, it's a market where the choices are pretty complicated. I think a lot of consumers feel the choices are pretty boring, not necessarily for their own livelihood, but just to the extent of kind of sifting through all the details of the different plans. And obviously, these are important choices that people have. Okay, a key ingredient that kind of mixes in, and I think all leads to kind of further issues in decision making, is that there's an inherent uncertainty in this choice. So the reason we have insurance is that there's health risk, and so people are dealing with kind of these issues listed above, but also dealing with this kind of idea of kind of thinking about their own risk and their probabilities. Okay. Another reason why kind of people who work in behavioral economics and kind of areas of informational issues like kind of insurance markets, like studying it as kind of a laboratory or using it as a laboratory, is that this is an area where, as many of you know, kind of market designers have a lot of input into the market, right? So health insurance is, despite kind of what we might think of as kind of the prototypical or kind of managed competition paradigm, there's a lot of regulation, and so regulators have a lot of ability to really kind of impact the choices people have and use evidence from this literature to inform policy, most importantly. Okay, so what I'm going to do is I'm going to give an overview of just kind of a couple papers in the literature that kind of document what I would call mistakes. And then I'm going to kind of move on from those kind of papers in the literature to talk about the solutions and kind of welfare implications. And so these first couple kind of papers I'm going to talk briefly about are really just to kind of get us on the same page about the extent to which consumers leave money on the table, or the amount of money that's kind of has been documented that consumers leave on the table. So I'm going to talk about two papers. One is a paper I wrote with John Kolstad in the AER in 2015. And what this paper did was it uses data from a large employer with about 150,000 consumers or covered lives. And in this paper, it's a nice laboratory to study choice effectiveness because there's only two plan options. So you could think of this as a simpler environment, of course, than what consumers face in most managed competition settings. And these products are differentiated financially, but not differentiated in terms of networks and providers and things like that. So this really is a lens into kind of the complexity of the financial aspects of choice. So what we do here is that it's been difficult in this literature to get kind of comprehensive characterization of what you might call information frictions or choice frictions because the data burden is high to do that. And so what we did here in this paper was we used a comprehensive survey, which we distributed electronically to many employees at this firm. And we used kind of a range of survey kind of questions and methods to ask them about what was their information about these two options that they're choosing between. And this was conducted kind of shortly after the open enrollment period, so shortly after they made their choices. Okay. And so since I'm being very kind of giving just overviews of a couple papers. There's a lot of discussion in the paper about, causality, identification, things like that. The way you should be thinking about kind of the results I'm going to show you here is that what we're basically doing is we have a lot of X variables for people. So what's your health status, what's your age, what's your gender, etc. And we're going to take those X variables, we're going to look at people who are similar on those variables, but different on the survey variables. So some people will come across as very well informed, they have very sophisticated kind of understanding of the insurance options, and some people are very uninformed, okay? And we're gonna kind of look at that difference in the model, okay? And so what we're gonna do here, there's kind of a lot of terms here, but I can actually kind of describe these equations pretty briefly. What we're basically doing in the model and the identification is we're saying people who in the survey are well informed, or kind of at the time of the choice, they're basically expected utility maximizers in this framework, so making choices that are consistent with kind of a very homo economicus type model. And then people who have indicators Z, which are kind of show limited information on certain dimensions, so about the deductible, about the coinsurance, about the provider networks, etc. They are going to have some deviation in their willingness to pay. And then we're going to, in the paper, talk about kind of what that implies for welfare purposes, because there's a lot of subtleties there. Okay. And so what are some of the results in this paper? I think probably one of the things which is more interesting to me was that take a case, so think about these two options as being differentiated financially, but not on the provider network. So you choose one plan versus the other, and the provider networks are identical, same. But many consumers in the population don't know that because it's not necessarily right in their face in terms of the plan materials and things like that. And so what we find once we kind of estimate this empirical model is that people who have limited information about the plan networks, actually, sorry, let me rephrase that. People who think that the more generous coverage option financially gives them access to more doctors and more treatments, which is not true, but people who think that, they are willing to leave almost $2,000 on the table in the plan choice relative to the same consumers in terms of X's who are kind of well informed that these provider networks are actually the same in practice. So the reason we like this this is one of many estimates in the paper. The reason we like this estimate is we know, this is something we know. We know the provider networks are exactly the same. We know the treatments you can access are exactly the same. Yet the information measures we have from the survey indicate that if you think you have access to more doctors in one, you're willing to pay $2,000 more. Okay. Now I'm not going to go into kind of what the mechanisms are behind generating that information set because we don't actually study that in the paper. One thing I wanted to also kind of flag is that in the survey we ask a wide range of questions related to kind of information about different plan features like networks and financial characteristics. This is a really simple histogram showing kind of the level of informativeness as answered by correct or incorrect answers to multiple choice questions, which have about 5 answers each, okay? And so here, 8 means that the consumer basically got all these questions about the plan, which are pretty simple questions, correct? 0 means you did worse than random choice, okay? And so here, when we look at this, this is kind of a signal of fairly limited information. The last thing to point out here, which matters for kind of the welfare discussion I'm going to have in the next section of this talk, is that once you incorporate these kind of signals of limited information into this canonical expected utility model, your estimates of risk aversion that consumers have change a lot, okay? In this specific case, they change from indicating a high level of risk aversion to a much lower level of risk aversion. And the intuition for that is just that these information signals or the level of information people have seems to be quite important for their choices. Yet in a typical setting, people just assume that that's going into the risk preferences of consumers or manifest in that way, which matters for welfare analysis quite a bit. So that was one paper, and there's more in the paper talking about kind of the money at stake. People on average are leaving quite a bit of money on the table in that setting. Another study to briefly talk about is a study by Bhargava and co-authors in QJE in 2017. This is a really nice study because it talks about consumers with kind of heterogeneous income levels choosing plans at a firm where many of the options are strictly dominated. So strictly dominated here means for any health state of the world ex post, you're going to be worse off in this plan you chose. So that's kind of in some sense, a very clear kind of case where someone's making, I think, what we would all generally refer to as a mistake. Okay. And so here, many employees choose a dominated option, losing on average $400. And they kind of talk about this as how this is good evidence about how in this setting, at least, something different than typical expected utility is in play. Okay. And they investigate a couple micro foundations. So one is kind of the complexity of the menu. In their setting, people have access to a lot of plans. So is it just that the number of plans is really high? They also investigate alternative preferences, which means, well, I have a high deductible plan that kind of changes my kind of payments on the margin throughout the year. Maybe I want to have a steady stream of payments instead of kind of different risk in payments. And then insurance literacy is a third thing they look at, which basically means how can you integrate kind of information about these concepts, okay? And they look at this in administrative data and also in lab experiments. And their primary explanation for the mistakes that they observe is that that people just have access to the information, but they're not integrating that information very well into kind of a accurate financial assessment of their choices. Okay, so that was kind of a whirlwind tour of two papers. But what I want you to take away is that those are two papers that try to use careful methods to show that people leave meaningful sums of money on the table in plan choices. Now, there are many more papers in the literature than these two papers, and many of them, for example, are in Medicare Part D. And in the Medicare Part D environment, a lot of the papers also kind of really apply more to settings where consumers have maybe lower income, or in some cases, very low income as seniors, okay? And so in those papers and in some of the papers I've worked on before, even separate from the ones I mentioned, one of the interesting things, which I'll talk about a little more later, is that these kinds of mistakes seem to be prevalent both for higher income people and for lower income people. And one thing I'll talk about more later when I talk about kind of future research and the impact it can have is that these mistakes seem prevalent in both domains, and they're likely prevalent in both domains for both types of people for different reasons. And I think that's going to be something that research can make progress on. Okay, so to kind of wrap up this discussion of just kind of evidence of mistakes, the one other thing I wanted to mention is that kind of these first two papers I talked about really are trying to talk about choice issues when consumers are engaged in a choice process. So, they don't have a default option. They're really kind of trying to make a choice in an active sense. There's also an extensive literature on inertia in these markets, which is kind of a slightly different type of information or behavioral issue, where the different papers on inertia, which is actually probably a more robust literature than this active choice literature, show that consumers are leaving thousands of dollars on the table often when the plan environment changes, but people don't re-optimize, whether it's because there's a default option and they don't pay attention, it's because they have actual switching costs, etc. And in settings where you have to switch providers, you could think, of course, there are very meaningful switching costs. In settings where you can keep the same providers, it's kind of, you often would go to one of these other explanations. Okay, people lose a lot of money because of inertia. That's what that slide says. So, so hopefully now, even though I know that's kind of a very short summary of some of these papers, hopefully now you kind of all at least have this sense, if you didn't already, that people are leaving quite a bit of money on the table in insurance choices. So then the next, I think the literature is actually pretty robust in that space now. But in some sense, I think some of the most important questions we still don't know as much about. So what are the implications of these mistakes or kind of choice issues for markets and market policies? And what can we do to correct them? And so what are some of the implications for market design and competition policy? So here I have listed kind of 4 things, and the coloring of these things, even though it's kind of ugly, the color scheme, it's there kind of to give you kind of a typical like traffic light style coloring. Okay, so green here are things that I think we can actually say a decent bit about with kind of what's been done in the literature. Yellow is something that I think we can say some things about, but maybe not fully characterize. And red are things that I think we know very, very little about. Okay? And so here, the two things at the top that I'm going to talk about more are first, regulation and welfare analysis, and second, adverse selection and choice quality. So the first bullet here, what I'm going to do is I'm going to say, look, the literature has done a good job of characterizing mistakes and choice issues, but not a very good job of characterizing the mechanisms, the kind of very detailed micro mechanisms behind these choice issues. What can we say, given that state of the literature, about policy? The second thing is the relationship between adverse selection in insurance markets and choice quality. And there, in certain papers and with certain identification strategies, you can say a lot about kind of the impact that choices, good or bad, has on adverse selection, which in turn has important implications for efficiency in insurance markets. Okay. So on the welfare side, when we're thinking about kind of how do you do, what's kind of a simple way to think about welfare when there's choice issues in these markets? In some sense, that's kind of not a very good statement, because there really is no simple way to do this in practice. But under a set of assumptions, I think it's possible to kind of have a reasonably simple characterization. So this chart is from a JEP paper I wrote this year with Josh Schwartzstein. And the basic idea here is you could think about a competitive insurance market with a flat marginal cost curve here, just to be basic and simple. And then there's a demand curve, which is the typical demand curve in yellow. And then there's a welfare curve, which is the curve in green here. And here, this is a very simplistic graph, but the basic idea is that if you can characterize kind of the extent of a choice error, at least ex post to the search process, then you can characterize what's called the welfare curve, which is basically saying, subject to a large number of assumptions I'm not going to talk about here, but the green curve here is basically saying this is what people should be doing based on our model and assumptions. The yellow curve is saying this is what people are actually doing. And then all of the possible reasons for why people aren't doing what we were saying they should be doing are kind of driving a wedge between these two curves. Okay? So say you're able to identify this. Okay? This kind of wedge between these two curves. Let me actually take a step back. So in a minute, I'll tell you what I think you can do if you can identify this. But first, I want to tell you about how kind of people in the literature actually identify the wedge between these two curves. So one way people do it is they compare decisions of experts in markets to similar, in quotes, consumers who are non-experts. Okay? And so here, a classic example in prescription drugs is there's a really good paper by Matt Genskow, Jesse Shapiro, and co-authors that looks at how pharmacists buy generic drugs as compared to how non-pharmacists buy generic drugs. It tries to control for as many X's as possible in the paper, and it says, look, the choices expert makes are quote-unquote the right choices in this environment, and the choices that non-experts make are kind of basically then seen as kind of different than those choices, and how different characterizes the gap between welfare and demand. Okay? The study I talked about with John and AER uses survey data to basically do the same thing, kind of uses survey data to say who's fully informed or not informed, or using the fully informed people in the survey as the benchmark for welfare. And then the third thing that some behavioral economics papers have done is what's called fully debiasing, which I think is a more questionable strategy, but basically the idea is to use experiments in a field setting or lab setting, or typically in a field setting, use experiments to fully debias consumers, which is questionable whether that can be done, and say, once we give people all of this information and this intensive treatment, we know they are making the right choice, and before they're not making the right choice. Okay. And so what can you say kind of from a policy standpoint? Okay, and in Josh and I's JEP paper, we talk about kind of two different classes of policies. So one is called what we call direct allocation policies, and one we call mechanism policies. So you can think about these terms in different ways. Direct allocation policies basically mean you've identified a demand curve for consumers and a welfare curve for consumers. Again, what they actually do and what they should do based on assumptions. And direct allocation policies basically mean you're implementing some sort of policy that is basically taking consumer choice out of the process of allocation. And so this could mean in an Affordable Care Act setting, it could mean even when there's choice, if you raise the minimum actuarial value from 50% to 60%, what you're basically doing is shifting all the 50% consumers to 60%. And so that basically, you can have a pretty clear sense that that's kind of shifting consumers or directly allocating to this type of policies. You can also think about a large of employers who shift people or force people to shift into high deductible health plans. If you switch from having a free health plan and you basically require all your employees to switch to a less generous plan, you can use what you've identified here with one of these strategies to do the analysis of this kind of direct allocation policy. What the mechanism policies, on the other hand, which we know less about, you can't really use this framework to say a lot about. So the mechanism policies would be, I want to change choice framing on a website, or I want to reduce search costs in a certain way. There you're basically impacting something that's intricately involved in the choice process, and you need to identify these specific mechanisms in order to really say what the impact of this policy will have. Okay? And so just as an example from the paper with John, in that paper, the firm we studied, they actually, in sample, forced everybody to switch from a very generous PPO option to a high deductible option. So a big financial cost sharing change. And so there, that's an example of a direct allocation policy. And so there, we can use the estimates of risk preferences and the wedge between demand and welfare from limited information or this collection of issues and say, what's the welfare impact of this policy change, okay? What we couldn't do is say something like, if the firm in the pre-period had reduced search costs, what impact would that have on welfare in this market and choices? Okay, how much time do I have left?
Your time, you're only 20 minutes.
Oh, good, good. That's good, because I actually think in some sense this is kind of setting the stage for stuff that I think is a little more related to the conference themes as we go through. Okay, so the last kind of thing I want to talk about that's kind of in this kind of regulation or market and frictions literature is the link between adverse selection and choice quality. So adverse selection, it's an inefficiency in insurance markets that really just results from the fact that firm insurer costs relate to who buys the product, as I'm sure basically everyone here knows already, okay? Kind of one of the insights from this literature is that, well, adverse selection is directly related to the choices people are making, but the choices people are making, as this other body of evidence shows, aren't necessarily very good. And so then what that means is that if you improve choices, not only does it improve the match quality of consumers to existing plans in the current market, it also should lead to some change in equilibrium pricing in the market as a function of which risks are sorting into which plans. Okay? And so one insight here is that improving consumer choices in these markets can lead actually to worse outcomes by exacerbating the degree of adverse selection. Okay? And so this is from a 2013 paper I have in AER, and there's now kind of a couple other papers that look at this as well. The basic idea is that in this setting I studied at one large employer, there was a lot of inertia, which I estimated in the environment. But in that setting, if in a counterfactual setting, so if you think about potential policies that could have been implemented to reduce inertia, the analysis shows that kind of actually reducing the extent of inertia consumers had in this environment would have led to increased adverse selection and actually kind of more unraveling in the insurance market. Now, this kind of adverse selection in general, increased adverse selection, will have implications for equity. It's not necessarily obvious what those implications are because you're taking kind of raising the prices for certain people or access for certain people in their distribution, but then for other people, you might be actually improving their choices on the margin when you give information. So these interactions are pretty subtle. I have a follow-on paper with John and Johanna Spinuin, where we basically kind of investigate what are, in a kind of broader equilibrium sense, what are the cases where one would expect information provision to worsen welfare by increasing adverse selection a lot relative to the match surplus, versus what are cases where information provision would actually be a good thing in the market, okay? And though this is a complicated three-dimensional table that maybe I should remove from the slides, the basic idea here is actually pretty simple. It's that we're thinking about these markets as a function of several micro foundations. So one is how good are consumer choices by some metric. The second is how much surplus do consumers get from insurance and how heterogeneous is that? That could be related to income, liquidity constraints, or risk preferences. And then the third thing is what does the distribution of costs look like for people in the population, okay? And the basic idea here is that, say you have a lot of confused people. So just for simplicity, let's say everybody's making kind of a random choice in this market, or a lot of people, 50% are making a random choice in an insurance market. When you're thinking about kind of everybody making kind of a choice like that, and then thinking, okay, let's improve somehow through a given policy, kind of the choice quality people are making. If costs are very heterogeneous, but the surplus in the market is not very large relative to cost, so the benefit, the match quality, is not very good in terms of like, you know, if I move you to your best plan, you get a lot better off, right? If that's not the case, and the costs are kind of more dominant in the market, then improving information is going to reduce welfare overall. Whereas if the surplus or the match quality, so for example, the heterogeneity and risk preferences is very high and important, then improving information is going to be a good thing. And the way to think about this is when you improve kind of consumer choices, you're basically impacting the match quality conditional on the set of options, and you're impacting what the set of options are via kind of the equilibrium outcomes in adverse selection sense. Okay, and I'm not going to talk about firm pricing with behavioral consumers, and the reason is that I think this is important, how to ensure price to consumers with limited information, but I just don't think we know very much about this so far. Okay, so let me turn kind of more broadly to insurance choice policy. So I think what these first two sections hopefully kind of give you a sense of is in this literature, there's pretty good evidence of mistakes. There's been some analysis of kind of what these choice issues mean for market equilibrium and welfare in these markets. I think that in some sense, a lot of the frontier of this literature is actually trying to figure out which policies can help improve choices and what are the implications of kind of different policies to improve choices, okay? And those implications could be kind of at the specific consumer level. It could be thinking about the distribution of consumer surplus, or it could be thinking about overall surplus. And so in this literature, so in the literature that really looks at kind of which specific policies can help improve choices, they're actually kind of fairly limited set of evidence that Josh and I could find before we wrote our behavioral handbook chapter from this year. And so one paper by Kling and co-author studies direct information to provision to consumers in Medicare Part D. There's recent work by Abeluk and Gruber that also studies kind of a tool to provide information to consumers and looks at the impact of that on choice quality. And then there's recent work by Bundorf and Polyakova that looks at this kind of information provision. So this kind of information provision in this first category, I think of that as kind of a consumer-driven policy. It's really trying to say, we've set up this market, let's let the market kind of function more smoothly by kind of having consumers be more informed about their choices. Another kind of angle is to go more on the side of kind of the paternalistic side and say, well, making this choice is really difficult. Let's, as a social planner, or as a firm, or as a government agency, let's regulate the choice set. So that could either be kind of via kind of actuarial value or via kind of plan standardization. There's a lot of ways where a regulator can impact the choice set. And this kind of regulation, kind of, if you're using that and studying the increment of that in terms of how it impacts welfare, you can use these kind of, this is more like a direct allocation policy, so you can use some of these identification arguments I was talking about before. Okay. So this kind of gives a sense, I hope, of the fact that, well, there's some policy analysis spanning the spectrum of kind of consumer-driven policies to more paternalistic policies. And what I want to do is kind of take a step back and, or take a step into this specific literature on kind of policies and how they impact choices, and look at kind of a recent paper I'm working on with.
That's your first.
Oh, okay, good. 10 minutes left.
Yeah.
Okay, so I want to talk about this paper I'm working on with John Gruber and Sam Kina and John Kolstad. And here we're trying to make a contribution to this literature on what policies can actually help impact consumer choices in a positive way. And so here in this paper, what we're doing is we're studying a different angle of decision support, which is we're studying basically expert-aided decisions for consumers in Medicare Advantage. So what does this mean? We're studying Aon Hewitt, who has a large exchange in the Medicare Advantage population. Okay, and what Aon does is they contract with employers like Starbucks and AT&T, and those employers will send either existing employees or retirees to this kind of curated exchange environment as kind of a benefit to the employees. That's the way you should think about it. And so when a senior calls who's involved in this, who's allowed to access this exchange, tries to choose a plan, they call Aon Hewitt, and Aon Hewitt sets them up with a broker who helps walk them through the process of choosing a plan. Okay? And so what we're doing in this paper is really kind of studying the potential impacts of expert advice on consumer choices and consumer choice quality. And so here in the environment, the kind of key identification aspect is that Aon Hewitt implemented this sophisticated decision support tool for their brokers, where in the pre-period, you should think of them as kind of just having a kind of pretty long list of plans that they could help consumers choose from. And then in the post-period, they have a curated set of options recommended to them by this algorithm, the broker does, that really is kind of targeted specifically to the individual consumers calling in and the data they have available for those consumers. Okay? And so we're going to use this pre-post, and we're going to ask two questions. First, do skilled agents consistently make good recommendations? So are the brokers themselves making what we would consider to be high-quality recommendations? And the second thing is, does the introduction of this kind of tool help improve performance? Okay? And what we're going to find broadly is that no. In fact, for this population of brokers, of which there are almost 1,000, there's substantial heterogeneity. Some are helping consumers make what look like high-quality choices. Some are not. And the second thing is that, yes, the introduction of the tool does help improve performance, and it eliminates a lot of this heterogeneity. Now, an obvious question is, well, how are the brokers paid? In this environment, they're paid by salary rather than paid by commission. And so that kind of takes out some of these kind of more complex issues related to broker incentives. Okay? And so what we find is, if you look in the pre-period, which is 2015, the estimates here, this histogram here, is showing the results from a regression that's basically bringing out broker fixed effects. And just to give you a little bit of background, in this environment, consumers are randomized to brokers. So when you call in, you get randomly assigned to one of these brokers. And we have a table that shows kind of balance and things like that. And then what we're doing is we've developed an outcome variable, which is money left on the table in this environment. And I'm not going to go into too much detail on that, even though that matters, how we construct that. And so then here, what this x-axis is it's saying a big number here, so a number of 1,000 here means you as a broker are making decisions, or your joint decision making with the people you're advising is causing them to choose plans where they're leaving $1,000 more on the table than a broker who's at zero. Okay, so 1,000 here is bad, negative 1,000 is good, okay, which might not be the intuitive direction. And so there's widespread heterogeneity, and what we do is we then kind of investigate the impact of this tool in reducing that heterogeneity. So first, we look at kind of the mean impact. And what we find is that on average, the introduction of this tool, which kind of helps curate the recommendation set that brokers give to patients, reduces the mean error, financial error by our definition, by about $300 on average, and does so across the distribution of brokers. Now, when we try to dig into the micro foundations of this a little bit, and we look at kind of a choice model, a discrete choice model, what we find is actually that in 2015, before this kind of program is introduced, the joint broker-consumer decision weights premiums relative to expected out-of-pocket spending by a ratio of 6-to-1, which also reflects results that have been found in the Part D literature and prior work. In kind of a fully Homo economicus rational type model, these two should be equal, okay, under some assumptions. But then in 2017, after this tool is introduced and kind of brokers are mandated to use it, sorry, which I probably should have mentioned about 3 slides ago, these coefficients are almost equal, which basically means that this kind of typically found bias between kind of overweighting premiums relative to expected out-of-pocket spending goes away in this joint decision. And so 2 more charts with this paper. This shows kind of what we do is each line here is broken down by broker quality as a function of the 2015 fixed effect. So 1, the blue line here, means the best 20% of brokers coming from our estimates in 2015, the pre-period. 5 is the worst. And what you can see is that in 2015, when you make this sorting or this categorization based on 2015, the heterogeneity of kind of money left on the table by the people who are with a good broker looks quite different than from a bad broker. And what that basically means is these 2 density functions are pretty different, okay? But then under the same categorization of brokers, so the people in 1 in 2015 are the same as the people in 1 in 2017 here, brokers. The lines are almost the same at that point, okay? So, and we interpret this as kind of the impact of brokers having access to this tool, which they're mandated to use or required to use, okay? This is the final chart on this paper. I talked about this kind of premium to out-of-pocket ratio, where basically a ratio not equal to 1 means you may be overweighting premium relative to out-of-pocket spending. Here the blue line shows by broker quality quintile what this ratio looks like in 2015. So for the best brokers, by our categorization, this ratio is about 2.5 to 1. For the worst brokers, it's about 16 to 1. And in the post period, once they're mandated to use this tool, this basically goes down to almost 1-to-1 for all of these brokers across these quintiles, okay? And so this is kind of just one look into what we're doing here and kind of one way that, one additional study that's looking at how we can actually impact the consumer choice quality as opposed to just documenting mistakes that consumers are making. Okay, so this is, that's just one paper. Yeah, question?
Does this have implication for the supply of plants in the market? Because now you're shifting the demand right in a way that should have been taken care of by the market itself.
Absolutely. So in the last paper, well, I won't go back to it, but in the inertia paper that I talked about where it's talking about adverse selection and choice quality, say we put this into kind of an equilibrium model, the impact of this tool, it would make a big difference in terms of selection, right? Because basically what you're doing is, if you're just considering the financial dimension and not kind of orthogonal dimensions like risk preferences or network preferences, you're basically going from an environment where people are making not random choices, but choices which are kind of noisy and confused, to choices that are basically they're picking based on cost, right? And so in an equilibrium environment, this could lead to greater adverse selection and welfare reduction, but it kind of would depend on the results I was talking about in the last paper, which was more theoretical on kind of what do the costs look like relative to the possible surplus. Now, we could do that calculation in this environment, and we haven't done it yet, okay? Now, from a very, very in-sample kind of analysis from a very kind of in-sample analysis perspective, you know, these brokers, there's about, this Aon exchange kind of sells to about 100,000 people. And so that's not going to make an actual equilibrium impact on Medicare Advantage in this very kind of in-sample context. Okay, so I think there's a couple questions to kind of wrap up with. I think this paper I mentioned is one in a kind of growing literature of how we can help improve choices. I think there's kind of two questions that I'd like to see a lot more evidence or on. One is kind of what is the limit of kind of what consumer-driven tools or expert-aided tools can add to choice quality in these markets? And the second question is the flip side, which is, how much can we get out of paternalistic policies relative to these consumer-driven policies? So here an idea would be, say we investigate every kind of information provision policy and things like that, and we find that we're improving consumer choice quality by some amount, not by a massive amount. We kind of know from a large literature on defaults, for example, in 401ks and other settings, that default options are probably going to have a stronger impact. However, there's consequences of default options, which is you may be steering people towards options which aren't good matches for them. How do we think about this trade-off? So there's a nice new paper by Abelak and Gruber that kind of looks at the trade-off between more choice and curating the choice set in Oregon public school districts. And their paper finds that kind of curating the choice set heavily actually helps consumers from a welfare standpoint. I have a Brookings paper with John that investigates kind of the difference between targeted defaults and information. And what we look at there is basically a targeted default policy where, subject to some...
So you're out of time.
Okay. So let me wrap up quick. I'll finish up in 2 minutes. The basic idea here is that, in this policy proposal is that we use consumer characteristics to define what the best option in the market is for them based on some model. And then with differing thresholds, we can actually implement that as a targeted default for someone. So that threshold could be very conservative. It could say, our model has to say you're gaining at least $1,000 in expected value before we change your default option or something like that. And so here we also look a lot at the distributional implications of that, because as you make the paternalistic policy more aggressive, you're improving efficiency, but also improving the increasing the probability of mistakes where you assign consumers to the wrong thing. Okay. The one thing I guess I'll finish up with is, this conference is about equity. And I think that there's a lot of work, basically all the work I've talked about really focuses on efficiency, okay? But I think there's a lot of room for work in equity, and I think the literature is close to actually being able to answer some questions, okay? So one question that I think is interesting is, there's this evidence, I'd say at least some evidence, that people with lower income have choice issues, people with higher income have choice issues, but I don't think that much is known behind kind of the mechanisms in these different domains, and I think the choices are quite different. So in a lot of cases where lower income consumers are choosing, I think liquidity constraints play a major role. And in the cases where higher income consumers are making mistakes, I think inattention or maybe lack of caring that they're losing $500 plays a big role. Okay? And so there's a lot more that can be done here. One thing I wanted to flag, and this kind of will tie in nicely to the last talk, is that in ongoing work I'm doing, we do have kind of pretty rich data from the Netherlands, which is, I guess I'd call it kind of an all-payer claims database. So all the claims for people in the Netherlands, along with a lot of linked socioeconomic data. So data, for example, on their income, on their education, on what their parents chose for their deductibles and kind of the supplemental insurance market and things like that. And so in that paper, what we're trying to do is really look at this income gradient. And at least kind of the very, very preliminary results show kind of a U-shaped curve where people at the lower end of the income distribution are opting out of deductibles. People at the higher end of the distribution are opting out of deductibles. But people in the middle are keeping deductibles in this market. And it's interesting to think of kind of what are the foundations between this, what are the links to education and the choices that are being made. So I know that's just kind of teasing work in the future that's kind of related to the theme of equity, but hopefully it's useful. So thanks. Oh, one other thing. I want to say, I want to thank Marika especially for doing the discussion, because I sent her these slides on Tuesday night. And so anything she offers is a huge bonus. So thank you, Marika.
So I'm very happy to have the opportunity to discuss Ben's talk on choice effectiveness in health insurance markets, mistakes, consequences, and solutions. And so I'm going to kind of repeat some of what he said in slightly different words with slightly different framing, and then I'm going to spend most of my time, instead of talking about what we do know, what we'd like to know, and sort of how far are we away from where we'd like to be. Okay, so choice effectiveness. Well, consumers have limited information and suffer from behavioral biases in many settings. And obviously the problem here is that consumers who have limited information or suffer from behavioral biases are going to make decisions that don't reflect their true preferences, and that could lead to harms that they themselves incur. So you can think about this as a type of sort of internality that could justify government intervention, or in the case of other sort of policymakers like the employer on behalf of employees, sort of broadly speaking, policymakers intervention. So how are healthcare markets different? Well, Ben pointed out a lot of examples. More generally, healthcare markets involve important decisions. They're relatively complex. But health insurance markets in particular have an additional complication, and that is that when you try to address things like internalities, make consumers make better decisions, there could be externalities on other market participants. And in particular, the key mechanism is that it's going to come through selection. The idea that when you resort consumers across plans by sort of hopefully increasing match quality, you're going to be affecting the plan offerings in the market. And that could have detrimental impacts or positive impacts on other market participants. It's ex ante ambiguous. So in a typical market, we usually think, okay, well, consumers are making mistakes. Let's just give them more information. The sort of efficiency consequences in the health insurance market are ex ante ambiguous. Yes, you're going to get some returns from reducing mistakes, but then you either generate positive or negative externalities, and depending on which case you're in, it could be that negative externalities would outweigh the sort of positive welfare gains you get from fixing consumer mistakes. So that's not sort of a very great takeaway. We don't like that takeaway. That's not a sort of super useful general thing to hit the ground running with, but that's unfortunately the kind of complicated world we live in. So let's take sort of for granted that you sort of want to fix consumer decision making. You want to help them make better decisions. That seems like an important objective in and of itself, potentially. What are the possible solutions that you have at your disposal? Well, there's a whole array of solutions, and Ben talked about a lot of them, but there's no sort of one-size-fits-all best solution that we can offer as the thing to do. Possible interventions may include things like providing information, restricting choice, offering smart defaults, requiring active choice, but there's important caveats and limitations. So with all of these, each of these interventions could either increase or decrease welfare, it depends on the context, and determining whether a given intervention will make things better, either in terms of efficiency or in terms of equity, requires knowing a lot about the market. That said, a lot of these are used in practice. And so let's talk a little bit about some examples of all these used in practice and how there may be scope to use more of them in practice. So in terms of providing information, there's some nice attributes about that go beyond economic efficiency or equity. It promotes transparency. It allows for consumer agency. Typically, we think about those as being good things. And most common examples kind of relate to providing information about product characteristics. So we see a lot of regulations about sort of needing to display prominently premiums, co-pays, things about networks, things like that, rather than match quality. But there's increasing use of information provision about match quality too, how your sort of previous spending might choose to prefer one plan over another. In terms of restricting and regulating choice, there's some inherent aspects of that you might like less, like restricting consumer agency. And most common examples with regard to restricting choice are of the variety of product standardization. Things like minimum network adequacy restrictions, minimum actuarial value restrictions, things like that. There's limited use of regulating or restricting choice based on match quality, although there's some use of that as well based on like geography. You're only allowed to buy certain plans in Medicare Advantage, for instance, depending on which county you live in, or based on age. There's some use of that in the Affordable Care Act. In terms of other policy options, you can require people to make active decisions. As Ben pointed out, mistakes are still made in active choice environments. There's limited ability to sort of correct mistakes through that type of thing. And it could result in real cost to consumers if they're forced to re-optimize. And we could think about defaults. And defaults could either be general or targeted, and probably are more effective when targeted, but we don't have as much research as we'd like to about targeted defaults. So Ben has this nice figure, and he put this up just briefly, but I'll sort of put it up again and explain it again. So on the y-axis, there's consumer agency, where increasing consumer agency is on sort of upward direction. And on the x-axis, he puts choice effectiveness, which you might think about broadly in the terms I just mentioned as sort of effectiveness at addressing internalities, right, is increasing in this direction. And there's sort of a typology here of different types of tools. Sort of the lower consumer agency types of tools might be nudge-based policies like simple nudges or smart defaults and things like that. And sort of the more consumer-driven kinds of approaches that have more consumer agency might be providing information or decision tools and things like that. So this is a super useful, I think, typology to have in mind when you're thinking about this. It clearly kind of plots two dimensions that are clearly important, like consumer agency and the effectiveness at addressing internalities, one potential sort of worry in thinking about the world in these two dimensions is that actually in this world there should be more than two dimensions. And so it's not sort of necessarily right, and I think it could be misleading at first to sort of look at this and say, oh, well, this orange dot's up here, it's clearly always going to be better than this green dot right here. We don't actually know that because there are other dimensions that are relevant for making this decision and the trade-offs across these. And so sort of important context to interpreting this figure is that other dimensions that could matter too include things like effectiveness at addressing externalities, like the consequences on the market allocations and the resorting that selection could present. Obviously, there's no one answer for all of these. There's no point identification, in other words, if you wanted to plot a third dimension. There's sort of a reason why they don't do that, but in a context-specific setting, there's going to be sort of things going on in terms of externalities, and that's an important thing to keep in the back of your mind as you sort of compare policies in any given context. And then the fourth dimension that I think might be sort of important to keep in mind as you sort of look at all these policies is sort of the information requirements that the government or whatever the relevant actor has to be able to implement these tools, and also to be able to evaluate or decide whether these tools were even going to improve welfare. And so in thinking about sort of enriching this literature, I think it's sort of important to think carefully about sort of what we can learn about these dimensions. And obviously there's going to be a lot of caveats and a lot of context-specific things, but sort of conditional on what information and kind of spelling out those information sets more precisely so policy makers have the tools they need to be able to answer these questions. Also, it'd be nice to sort of think about how to weigh all these dimensions relative to one another. Our typical welfare calculations in the insurance literature, as been mentioned, oftentimes abstract from equity and think purely about efficiency when we're thinking about sort of dimension 2 and dimension 3. Sort of ignoring the other dimensions, but you could think more comprehensively, how do we think about dimensions 1 and 4 in parallel to 2 and 3, and how do we think more carefully about trading off dimensions 2 and 3 in terms of equity, not just efficiency. In terms of sort of related remaining important questions for the literature, so Ben outlined a ton of them. Here's just a few more to fill that out based on kind of what I had just said on the previous slide. We could learn more about information requirements, identifying mistakes, and having a more comprehensive framework for these kind of evaluations. Let me talk about each one of these one at a time. So in terms of information requirements, it'd be great, I think, for as a literature, as economists, who work on insurance, to think more about what information is required for different types of tools, both to be able to implement them and to be able to determine whether or not they're going to do any good. So what market fundamentals do you need to have as a policymaker to be able to determine in a reasonably confident way that providing information like one of these low-touch tools will increase welfare, or at least do no serious harm. There's a little bit constructed in the literature, but based on one of Ben's previous papers, and it has sort of an important point here, and that is markets that have extensive risk adjustment have limited scope for externalities. There's limited impact of what's going to happen with selection, and so if there's a market with extensive risk adjustment, then the internality reduction is going to dominate, and generally speaking, it's going to be a good idea to provide more information and try to reduce information frictions. But the more sort of results like this, but potentially with more caveats that we can build up in this literature, I think the more useful it would be for policymakers to be able to get generalizable lessons and to be able to sort of make policy on the fly in these markets. How do these information requirements depend on the policy tool at hand? So do we need strictly more information to do sort of choice restriction policies than providing information policies, than default options or something like that? Kind of giving people sort of a sense of how to think about that topology in terms of what the policymaker needs to know to figure out if they're a good idea or to actually implement them in practice. In terms of identifying mistakes, I think we have some work to do here, both from sort of the policymaker's perspective and what they need, and also what we need as economists to be kind of confident in what we're doing. From the policymaker's perspective first, I think sort of it's important to think about sort of less convenient markets than the kinds that we typically study as economists. I think oftentimes we're focused on, as researchers, convenient markets where it's easy to identify some mistakes. There's some nice variation to be able to find, inertia or limited information or this or that. You can run the survey, you can find the experts, you can do whatever to sort of identify these things, but this isn't always available. So how do you do welfare analysis as a policymaker or make these kind of policy decisions if you're still concerned that behavioral biases could be there? So that's why it's so useful to come up with the kind of results that Ben has in some of his work that, well, if there's a lot of risk adjustment, provide some information. At least we know you can do that. Everything else, we're not really sure what's going to happen. But more results like that could be really useful. Even in settings where there is variation, to study one of these sources of poor quality decision-making, like inertia or limited information, there are always other sources of mistakes, and we don't usually have the data to be able to look at those. So kind of thinking carefully about what that means for welfare analysis and our overall policy recommendations, I think, is important. in terms of from the researcher end and identifying mistakes, I think there's still some more to be done there, although there has, I know, I'm going to take a little extra time, I'm sorry, a little bit more to be done there. And one thing in particular is I think it's important for us to fully explore the alternative explanations for why consumers make the decisions that they do that appear to be poor quality. So for instance, does choosing a dominated plan or even a strictly dominated plan necessarily mean that consumers have made a mistake? I would say the answer is no. Another possibility is that we just have the wrong model. And in particular, one dimension on which our model could go wrong has been pointed out by a recent working paper by Erickson and Sidnor, and that is that it could be that an alternative explanation for why people picked plans that look dominated is that they have within-year liquidity constraints. So it may be that fundamentally, if you have trouble saving and borrowing throughout the year to finance uncertain consumption shocks, it could be that you trade off premiums and out-of-pocket costs differently than someone would who didn't have those liquidity constraints, and that could actually, they show in their paper, quantitatively explain a lot of choices of dominated options in practice. And so kind of feeding back between theory and empirics, I think, is important in this space to sort of make sure that we know what policies are going to be useful. So for instance, if you believe the Erickson and Sidnor story, you want to give low-income people sort of low-interest credit cards to sort of help solve the problem, more so than the other kinds of policies that we've been talking about so far. Okay, so in terms of the last point, sort of comprehensive framework to be able to think about all these things, could we make any progress in thinking about the other properties of these policy tools like consumer agency within a unified framework that we think about welfare typically in terms of externalities and internalities that we typically think about within our typical models now? So most research to date is really focused on individual decision-making across health insurance plans within a specific decision environment and how that varies depending on the decision environment. But I think we could use more research thinking about how individuals value properties of that decision environment itself. For instance, how do individuals value in a revealed preference way sort of having more options in their option set? Or how do they value having a targeted default? I think we implicitly want to look at this figure and say consumer agency good, but it very well may be that people actually like having a default. They like having a smart default. It makes it easier for them to make a decision. They like having low quality choices taken out of their option set. That's not maybe the way we would normally think at looking at taking sort of an Econ 101 class, but that still very well might be the case, and we need research to figure out if that is the case and understand this trade-off more fully. So I'll just end there saying that I think this figure is great, and I think future research can kind of build on thinking about what other dimensions are missing from this, how can those dimensions be useful for other policymakers, and how to think about this sort of elusive like consumer agency dimension here and how people feel about that in a revealed preference way. All right, thanks.
Thanks so much, Marika. It was really, really cool and really interesting. Very helpful. A lot of things to stew on and think about more. Stew on in a good way. I have some comments, but I know actually the time, we've kind of taken a lot of time already, so I think I'd rather just see if anyone else has comments or questions. Yeah.
Oh, me? Sorry.
Yeah, no
Ben, in the Aon Hewitt paper, I was just curious, was the tool measuring the value of policies the same way you were in the regression, or were you measuring the value of policy choices in a different way?
No, it was doing it in exactly the same way. And that's something we're actually thinking about. It's very much a working paper. Actually, there's no working paper, it's just slides right now. But yes, and so there what we're doing is the tool is using kind of an algorithm that kind of has a number of factors that go into it. One is kind of expected cost in terms of premiums and out-of-pocket based on some inputs from the consumer. And other inputs that come into the tool are, for example, risk aversion based on some kind of measures from the literature crossed with questions that are inputs. And could include measures of provider network satisfaction, even though we're not doing that, the tool isn't doing that in kind of the implementation we have. But the long story short is that yes, the kind of Y variable in the regression is the same as kind of the thing which is determining the quality of the recommendation.
So right now we should think about the key, I would think, the key finding in this paper is that there was so much ex-ante variance. That's sort of what's surprising in a sense.
Yes, yes. In some sense, the fact that there was so much ex-ante heterogeneity in the choice quality, and that's being reduced a lot, that's kind of, doesn't matter what you're using. In some sense, the Y variable there is going to be meaningful even if you used a different model of choice quality. Whether or not kind of the model is a perfect predictor of what the best plan is, it's certainly not a perfect predictor. That would be unlikely. And what we're doing in kind of the current work with the paper is trying to dig into kind of the broker heuristics or decision models. So say, okay, say we're classifying you as a bad broker in our model. What were you doing? Like, were you choosing certain brands? Were you choosing certain types of plans? And also importantly, say you're a good broker and you're deviating from what we call a good decision. Ex post, does that still look like a bad decision or not? And if not, why not? So we haven't done that, but that's where we want to go. Yeah.
I think I have a question, but it depends on the answer to the first question, which is, do people have to use a broker in this model, or is it their choice?
So, in my understanding is yes, which is a little weird and not, I'd say, what a typical choice environment would be. My understanding is that they enroll in this kind of, their employer gives them access to this exchange, and they call this broker to engage. Now, that's something where, like, to be very honest, that's what kind of my co-author told me, and I still kind of have some, so like, really, is that true? So there's a little more to explore.
I think that's an encouraging answer, because my impression from the literature is when you give these tools, for example, there are lots of experiments now where you give people tools where they're told if they get a test and it's really expensive, they're told, oh, if you use this, you'll do better. And these tools are having almost no impact. So it seems like when you give people the ability to draw on information out there, like the brokers, generally they tend not to use it, and you probably need something more active, like requiring that they go through this process.
Well, that's a really good point that I haven't really ever thought about or talked about in that paper, which is that it is kind of an information provision type environment, but it's mandated that the brokers use it. And what that means in practice is when the person calls them, the screen pops up with the recommendations right away. And also on the consumer side, if they're required to kind of use the broker, it's still a stronger policy than allowing the consumer to opt in whether you use this or not.
Question?
Well, I can.
One last
one. I'll be skipped till I can ask mine later.
Just as a clarification, so in your first paper, when you found that they are leaving $2,000 on the table, was there a distinction between they're choosing a similar product but paying more, or paying the same amount for an inferior product? And the reason I ask is that you made the distinction between this welfare demand and actual demand, which was monotonically shifted out.
Yep.
Right? But for a product specific, it may not be monotonic, even if they're making mistakes.
Yeah, absolutely. And so that graph was way oversimplified. And so what we do in practice, and especially in the follow-on paper with Spinowin also, is we basically allow free kind of correlations between these micro foundations, the kind of choice issues, the risk aversion, which is like the surplus, and the cost. And we measure those correlations empirically in the data at the individual level using the survey, the observed cost, and the estimated risk preferences. And so I think that that's certainly done in kind of a more in a more kind of subtle way. Now, to get to your first question, really what it involves, because there's only two choices, where that identification really comes from is saying, look, think about consumers as kind of ranked in terms of costs, and then cut on costs, think of some people as being informed and some people as being uninformed. And basically what you're doing is you're saying, look, the more generous plan is kind of in a financially worse situation for consumers. It's kind of like the worst option just based on the way the premiums are set up. But people might think it has these additional doctors, which it doesn't. And so then what you're doing is you're basically saying, look, if you're uninformed, you're going to go for the higher plan at lower cost levels, right? Because say your expected cost is low, but you think the doctors are better, then if you're uninformed, you're going to choose that more generous plan. And so it's really looking at kind of the proportion of choices, informed versus uninformed, conditional on cost. And that's where the dollars are coming from. So it would be like saying expected cost of $4,000 is a cutoff if you're informed, and 2,000 is a cutoff if you're uninformed. So it's using
so it's really the former, that is the same product, but some people are paying more.
Exactly, yeah.